Gynecomastia can be done on guys totally awake with just some local anesthetic. It can be done with local anesthetic in addition to some medicine put into an IV. And it can be done on guys totally asleep. It depends on how much we're removing, how muscular the man is, what his tolerance to pain is, and what my preference will be in getting the best sculpting for each man. In general, I like to put the patients to sleep because that way there's no issue of pain. I'm never inhibited during the procedure that I want to go somewhere and smooth it out a little bit, but that one area remains painful. Sometimes when you do gynecomastia, there's one area that hurts, and no matter how much pain medicine you put in it, it still can hurt. Now, I've heard some doctors say, none of my patients complain of pain, but they're giving the patient medicine that puts them almost totally asleep by mouth. So they're really not truly doing it under a local anesthetic, and it's not safe to get a lot of pills by mouth where you're all that groggy. So I think I usually get the most comfort and the best overall contouring on a guy that's asleep. However, if a guy just has one little nubbin that needs to be removed, I can cut that out very comfortably on them awake. And if a guy is very obese, I can also do those actually under local quite well because the nerve endings that hurt are usually not in the fat. It's in the overlying skin and the underlying bone and muscle. So when you have a skinny guy, just the vibrations will hurt the body beneath it, the bone and muscle, or the skin above it. But the thicker that it gets, the more I'm working in here, and they're not getting pain. So in general anesthetic works the best to do a great sculpting job, the most comfortably, but there's a role for having IV sedation or just local in selected patients.